Hello, my name is Babar Fiza. I am an intensivist and anesthesiologist at Emory University. Today I will present the POCUS case of the month for July 2024. This presentation is part 1 of 3 in this particular case. Our case involves a 77-year-old woman who is scheduled for a mandibular fracture repair under general anesthesia and would require a nasotracheal intubation. Her past medical history includes Parkinson's disease, dementia, and type 2 diabetes. Her past surgical history includes a colonoscopy and hip arthroplasty. The patient is currently on several medications, including carbidopa, levodopa, donepezil, and metformin. Regarding the patient's NPO status, she reports consuming breakfast 3 hours before her presentation. However, her caregiver reports that she has been NPO for over 6 hours. Due to this discrepancy and the uncertainty about the contents of her stomach, a gastric ultrasound is performed to assist with anesthetic planning. Before reviewing the ultrasound exam findings of our patient, let's review the ultrasound examination findings of the gastric antrum at various prandial states by addressing the following question. Of the 3 panels, which panel shows an empty stomach? Panel A, panel B, or panel C. The correct answer is panel A. The appearance of an empty stomach on an ultrasound typically resembles a bullseye. This is characterized by a small or collapsed antrum, which is surrounded by the distinct sonographic layers of the stomach wall. These layers are sonographically distinct and provide a clear outline of the antrum. In many cases, even a physiological empty stomach contains a small volume of clear liquid, which represents baseline gastric secretions. These secretions are a normal part of gastric function and help to maintain the stomach lining. The presence of this small amount of liquid does not indicate that the stomach is not empty, but rather reflects the normal physiological state. The important identifying features of the stomach on ultrasound, which can help differentiate it from other hollow viscera, include its multi-layered wall and its consistent anatomical location. The stomach wall has multiple layers, although not all 5 layers are typically visualized with a curvilinear probe. These layers include the mucosa, submucosa, muscularis propria, subserosa, and serosa. Furthermore, the stomach has a hypoechoic or dark outer rim on ultrasound. The stomach's outer rim appears dark on ultrasound because this layer of the stomach is comprised of muscle, and this muscle is hypoechoic relative to the surrounding tissues in the abdomen. Additionally, the antrum segment of the stomach is consistently located adjacent to the liver edge, with the aorta typically seen in the far field of the image. This consistent anatomical positioning helps in distinguishing the gastric antrum from other hollow organs in the abdominal cavity, such as the intestines. Recognizing these features is crucial for accurately identifying the gastric antrum and assessing its condition during an ultrasound examination. This detailed understanding aids clinicians in making accurate diagnoses and planning appropriate treatments. Compared to an empty stomach, in panel B, a distended stomach is visualized with an admixture of anechoic liquids and hyperechoic solids floating within the liquid. This ultrasonographic evidence of thick particulate fluid or solid content within the stomach suggests possible incomplete gastric emptying. This condition could be due to a recent meal where the stomach has not had sufficient time to fully empty, or it might indicate prolonged gastric emptying time, potentially due to underlying gastrointestinal motility issues. In panel C, the antrum is noticeably distended with clear liquids. This distension is evident by the expanded antral walls, which are separated by anechoic or dark area, indicating the presence of fluid. Unlike the particulate or solid contents as observed in panel B, the fluid in panel C appears to be more homogeneous and likely represents ingested clear liquids. Now let's return to our patient. For this patient, following subxiphoid parasagittal view of the abdomen was obtained with the patient in the supine position. For continuation of this case, please watch July 2024 Focus Case of the Month Part 2.